As Yogi Berra once said in his inimitable way, it's deja vu all over again. We're faced with yet another subvariant of the COVID 19 virus. We welcome Niagara's acting medical officer of health, Dr. Mustafa Hirji, to the program. Dr. XBB 1.5, this may be the most transmissible variant of the virus yet.
Yeah, that does seem to be the case. Viruses, I think, follow the same pattern as most organisms in that they evolve to have better survival advantage. And for a virus, that means being able to spread more easily and being able to spread and get around the immunity of people. And what we see with the XBB.1.5 is, yes, it can spread more easily and more quickly. And some of the immunity we've built either through vaccination or through past infection is not going to protect us as well from this variant. So it's definitely going to be able to spread more quickly. We're a little unsure about the severity of it. There's some thoughts that perhaps it could be more severe, but I don't think we have really good data to confirm that. What this means for us is that in the short term, we should take some additional precautions to make sure we're protected from COVID-19 and this variant specifically. Definitely the key part of that is making sure people got their booster dose this fall. Since September, everybody 12 and up should get a booster dose. If they haven't got it, make sure they get it. Age 5 to 11 children, if they've gotten their first 2 doses, they can also get a booster dose 6 months later. And of course, the other part is wearing masks while we are indoors or in outdoor spaces. That's going to limit the ability of this virus to spread. Longer term, because this virus keeps evolving to come back and cause us more trouble, I think we need to make some definitive investments in improving air quality. So ventilation, filtration, far UV, so we can kill off the virus in the air that it spreads, stop it from spreading, and stop it from being able to keep mutating like this.
As we're stuck in the winter months and we've had a lot of gloomy weather over the last week or so, would you recommend that people start looking at filtration systems for their homes? I mean, normally in the summer we can keep windows open and things like that to get the airflow, but it's harder in the winter.
Definitely harder in the winter. I'm much more concerned about public spaces, spaces where people are going to gather, because that's really where you're going to see infection spreading from person to person a lot. Of course, absolutely does occur in the home. I'm not sure how much more ventilation is going to do, just given that we spend a lot of time face to face in close quarters with each other at home, sitting around the dining table, etc. The things I'd suggest people can do in their home, though, is make sure that the furnace filters you have are a MERV 13 filter. That's a good enough filter that's going to remove most of the virus from your home, and you don't actually need to retrofit anything. When you do that filter change every few months, you just put a MERV 13 filter. That'll remove the virus. And the other thing I'd suggest is make sure that your HVAC system is kind of running continuously. So it's not on an auto setting where it turns on and off, that it's continuously cycling the air. So that means it's continuously going through that filter and removing the virus.
Long-term care homes are being hit hard once again. I'm not sure if it ever really eased that much in long-term care homes, but right now is a crucial moment there.
Good news is that I think long-term care homes were far more poorly hit back in the past. I think back to the start of 2021, we had in January 2021, over 100 people in long-term care died just in that 1 month alone. And we thankfully don't see nearly that many people dying in long-term care home as well. And the outbreaks we have are smaller. But you're absolutely right that outbreaks in long-term care home have never stopped. Since March of 2020, we have continuously had outbreaks in long-term care home, and they're continuing to deal with those right now. I think that's another reason why it's so important for all the rest of us to get vaccinated, get our booster doses, and wear masks, because if infection isn't spreading amongst us, it's not going to spread to the staff member who works in the long-term care home or to the family member who comes to visit loved ones. And that means it's not going to find its way into long-term care homes as much, and we can protect all of those residents. We've sadly seen, I think, 10 of those residents die in the last 5 weeks, and this is one way we can hopefully save more of those lives.
Doctor, over New Year's Eve, we saw pictures of people gathering together, sometimes out of doors, but often inside as well. And it's really clear that people aren't getting the message right now to continue to wear masks inside. Very small percentage of people are actually doing this.
Yeah, I think that's true. I don't want to put too much on sort of New Year's Eve gatherings. A lot of those are going to be gatherings where you are eating and drinking, and unfortunately, you can't do that with a mask. And we totally understand that people aren't going to wear a mask when they're doing that. But I think on the other times when you're not eating and drinking, you're out and about, you're seeing people, you're in a crowded space. that's when I think it's really important that you wear the mask, because that mask isn't going to get in the way of you participating in your activity. It's a little bit annoying, but it's not going to get in the way of you doing what you're going to do, and it's going to stop the spread of the virus. So that's what I'd really emphasize. You're absolutely right, though. I go to grocery stores, I go to other stores. Not many people are unfortunately are wearing masks right now. And I think now is a really critical time with the XBB.1.5 variant coming, with us just having those holiday gatherings, and maybe some virus did spread through those different gatherings. And now we're going back to work, we're going back to school, and it's going to have another opportunity to spread again. This is a time when it's actually really helpful to be a little more vigilant so we can stop any kind of surge.
Back when public health was holding the clinics for vaccinations, the uptake was much faster, much more healthy, I guess. How can we get to some of those levels for the boosters without running these public health clinics?
So we still have a small clinic in public health. We run one occasionally in Port Colborne, and we have one at the Penn Centre in St. Catharines. And of course, pharmacies, primary care, they're offering vaccines as well. And there's actually more capacity right now to be delivering vaccines, and people are coming to get it. What I think has happened is that back in 2021, when we're doing the first round of vaccination, we really had all of society buying into the importance of this. We were in a lockdown at the time. This was how we were going to get past lockdowns. And I think it's true. We did get past lockdowns thanks to people getting vaccinated. But we haven't got to the point where we've actually ended the pandemic, and we haven't got to the point where we're no longer seeing people dying of this virus. And that requires, I think, people to continue to get boosters. What I think would be really helpful would be much stronger promotion by our provincial and federal governments. Back, in 2021, they are very strongly promoting the virus. They're pretty silent right now, and I'd like to see much stronger promotion from them. I would also like to see them actually come out and give some sort of incentive so that there's actually some positive benefit people see that beyond just getting the protection from COVID-19 to go out and get the virus. Something I floated is that we should have a tax cut, a rebate on the Ontario health premiums we pay as part of our taxes if you go and get vaccinated and get your booster doses. That means you're not going to be spreading the virus to others. You're going to be saving the healthcare system costs. So let's return the favor and save people some money on their tax returns. And we have a government right now who's very supportive of tax cuts. I think this would be a great win-win. It's a tax cut for people. It makes our society healthier overall. Everybody wins.